Hi, I'm Lexy Young, and you're watching Body Language, a series where we have candid conversations about women's health and anatomy, because in 2026, our bodies shouldn't be mysteries anymore. With me today is Bailey Taylor Brown and Dr. Chrissy Freeman.
So let's jump right in. I feel like we're here today to talk about something that is just not verbalized enough. It's about women, young women, girls, silently suffering due to reproductive or chronic illnesses. And I just feel like at this day and age, we shouldn't have to do that. And we should be vocal and we should talk about it. So I'm really excited that we're all here together.
Yeah.
And I feel like it's time for women to just not feel embarrassed about talking about their body and also like being an advocate for themselves. And Lexy, I mean, you just do such a good job talking about what you're going through and also connecting with other women that are also going through what you're going through. And as your friend, it's been really amazing just like watching you, be so vocal, and it's been so powerful. So, I want you to kind of take it off and tell us how you've been and what's been going on.
Thank you. Well, even hearing you say that is so impactful to me, because my journey to being diagnosed with stage 4 endometriosis and PCOS was a very long one. And it was a time for me that it was very confusing. There wasn't a lot of literature out there, conversations about women's health. To your point, women's health issues were kind of hush hush. I went through all of my teens and my 20s not knowing what was wrong with me, and really fighting for answers in doctors' offices, getting different diagnoses that were not accurate, and just being very self-conscious about my body and what was going on. And I finally got a diagnosis in 2018, and it took me over a decade to get it, with stage 4 endo, and it was all over my reproductive organs. It still is. It's a continuous disease. It has no cure, all the way up to my lungs. And there was a period of time where I felt ashamed of the diagnosis, but it has turned out to be the most empowering thing that's ever happened to me as a woman. And I feel called to share about endometriosis, share how it's impacted my life, and reach younger women. So when they get that diagnosis, if they're rolling out of the OR like I was, and you're just flooded with information, you have someone that you can look to and say, it's okay, I'm gonna get through this. And the statistic is 1 in 10, which I believe is even more, probably like 1 in 7, 1 in 6 women have endometriosis. It is so prevalent. And so I really think we need to have more open and honest conversations so women can go to the doctor's office and advocate for themselves and stand up for their pain in their bodies, because a painful period is not normal when you're debilitated and cannot get out of bed, cannot perform your job, cannot do normal social activities. I'm sure you see this all the time in the office with people coming in and saying, I have a painful period, and not knowing where to go from there.
Absolutely. Absolutely. And thank you so much for sharing your story. It's really powerful and impactful to see how you use your voice and your platform to speak out about this.
Thank you.
We can also start by just kind of defining what endometriosis is. So endometriosis is a very complex chronic medical condition where women experience lots of pain, inflammation all throughout the body. As you mentioned, endometriosis can be definitely on your reproductive organs. It can also be on your bowels, on your bladder, up to the diaphragm, really anything in the abdominal cavity. And so at different times of the month, for some people it's every day. For some people, they have flares during their period or during ovulation. But patients or women can really experience a lot of pain, which is debilitating, can't go to work, can't hang out with friends, and it can really impact your life globally, not just physically, but mentally, emotionally, spiritually, all of the things. And so I'm so glad that we're here talking about this.
Yeah, definitely. And I think it's important to note that there's no one-size-fits-all diagnosis for endometriosis. Yeah. Someone could have stage 1 and have potentially more aggressive symptoms than someone that has stage 4. And it also doesn't present the same in people every day. Like you said, some people it might flare during their cycle. Some people it might flare every single day. It's a very unpredictable disease, which I think makes it very complex living with endometriosis, especially as a female, because you never really know what your day is going to hold. And that, for me, through my 20s led to a lot of anxiety, where I didn't want to leave the house. I felt nervous going to work because I didn't know when I was going to be hit with endo belly, which I know is something you saw.
Yeah. So I was going to mention, so Lexy and I met filming Bachelor in Paradise, and that's where we really, I feel like formed a deep, close friendship. And watching her not be able to eat breakfast with us in the morning or hang out with everyone at certain times in the day because she was struggling with endometriosis symptoms and endo belly especially, that was really hard as her friend watching that. And it also made me think about my other friends that maybe also have other symptoms similar, and being like, oh, they need to be checked. They need to really like voice what's going on with them to their doctor. And like, I think it was really hard watching you go through that. And I think it was even harder, like also watching there's moments that you weren't able to be a part of on screen because you were still trying to like be present and still trying to find love while you're battling all of this. So I can't imagine also like how hard it is during everyday life as well.
Yeah, it was really challenging, if I'm being honest. And that's why when I was originally on The Bachelor, I made the decision actually on the drive to my date with Joey that I was going to open up about endometriosis because it affects you in so many ways, to your point, and it's so unpredictable. And it was a part of my journey, both on Paradise and The Bachelor. On The Bachelor, I ended up in the emergency room at UCLA and had to leave the house during the talent show episode, which was such a fun day. And I had a huge ovarian cyst. And it was just, it's one of those moments where you're like, or at least I self-reflected, why can I not just be like these other girls here? Like, why is this happening to me? But I will say, and I want this message to reach anyone that has endometriosis or is struggling with these chronic conditions, I did the show. I did it successfully. I had the best time. And I truly believe that having endo makes me a more empathetic human, and I view the world through a different lens. So I really wouldn't change anything. It's just some little bumps that come up throughout my life that I have to deal with that some other people don't. But everyone's dealing with their own internal physical battles in different ways. Endo just presents very visibly. But yeah, on Paradise, it was very long filming days, and it was very hot in Costa Rica. And I would wake up and have horrible endo belly. I was swelling, internally bleeding. And unfortunately, the only thing, at least for me with endo belly, is time that helps pass the inflammation going down. And then I felt like I could go back and be in a bathing suit and try to find my partner, which was the point of being on the show. So yeah, I'd be curious to hear your thoughts on endo belly and how it impacts your patients.
Yeah, for sure. I think something that you also mentioned is that endometriosis is very likely underdiagnosed. And even speaking as an OBGYN, our reproductive group, ACOG, or American College of Obstetricians and Gynecologists, recently released new guidelines so that hopefully more women can get diagnosed with this condition. Previously, endometriosis was something that had to be diagnosed surgically, right? But how many steps, how many years does it take to get to a doctor that's willing to do that surgery to give you your diagnosis, right? And so now they've kind of changed things to where if patients are having enough symptoms, so pain, pain with their periods, pain at these other times of the month that we talked about, anything that's getting in the way of them, completing their daily life activities or living the life that they want to, patients can be diagnosed with endometriosis clinically and can meet criteria for treatment without even going through surgery. So I think that's a really big step forward, and hopefully it will allow more patients to get the care and the treatment that they need.
Yeah.
And so medically, what's happening in someone's body when they're experiencing these symptoms is that the endometriosis implants, which in the past we used to think that endometriosis was like the inner lining of the uterus that you normally shed during your period, has somehow migrated outside of the uterus. And now it's on all these other places and causing pain and inflammation. But there may actually be a bigger picture to this, which I think is where a lot of research is needed. But with all of these implants that happen throughout the body, they're shedding, like you said, like you can be bleeding internally because they respond to the same hormones that happen when you have your menstrual cycle. So the same way someone would have their menstrual from their uterus coming out of the vagina, it's happening at all these different places in their body, whether on the ovaries, on the diaphragm, on the lungs, like everywhere. And so this can be, all of these places that the endometriosis may be, whether it's on nerves, right? Like people get shooting pain down their legs, can't go to the bathroom, can't pee, like all the things because of where endometriosis is and the havoc that it's really wreaking on the body.
That happened to me directly with my bladder. So it's all inside my bladder and outside of my bladder. So I was diagnosed with interstitial cystitis on top of endometriosis. They're called the evil twins in the medical world. And it's exactly that. Those lesions are, bleeding and they have nowhere for the blood to go. And it's basically causing the bladder to contract and mimic a UTI and no cure. So it's like living with a UTI every day, but there's no medication that you can take. And that has to be one of the most mentally difficult, physically horrible, challenging diseases, I'm sure
Yeah.
you see a lot of patients with IC.
Absolutely.
Yeah.
Absolutely. Like you said, they kind of go together, right? And what I wonder in my practice is how many patients are having other symptoms that, whether it's bladder symptoms, whether it's bowel symptoms, are these symptoms actually endometriosis, and something that we should be paying attention to a little more closely?
So I know we kind of touched on endometriosis a little bit, but Lexi also shared that she is also diagnosed with PCOS. And I think
Yeah.
I would also love to know, what is PCOS? And
Yes.
I know it's just had a name change. So like maybe
Yes.
maybe you can kind of give me a little more education on that and really
Yeah.
what is PCOS, what is PMOS, what's going on?
Absolutely. So PCOS is the classic name, which stands for polycystic ovarian syndrome. The new name is polyendocrine metabolic ovarian syndrome. So it added a little bit in there. And I think there's a lot in a name, right? Because the way something is named, that's a label, right? And so it shapes how we think about the condition, shapes how we think about a condition, how we label it, who it impacts, right? And so with PCOS, when it was called polycystic ovarian syndrome, I feel like the ovaries took all the blame, right? And, in women's health, a lot, I feel like we tend to put things in silos and make them much simpler than they are. But with PMOS, it emphasizes that there are multiple hormonal pathways involved in this condition that impact the ovaries. It's not the ovaries' fault. They're doing their best, right? But when everything is dysregulated, that leads to a lot of the symptoms that women have, such as irregular periods, inconsistently ovulating. They may go months and months without a period, and when it does come, it's extremely heavy, right? And so there are lots of women out there suffering from both of these conditions and not getting the diagnoses that they deserve.
Should we
Would you-
use, oh wait, what were you going to say?
Would you say the involvement in the endocrine system has to do more with the systemic effect of PCOS on the body, like weight gain, facial hair? I'd
Yeah.
be curious, like, why bring in endocrine into the name?
Yes, that's a great question. So, a lot of the hormonal dysregulation in PCOS stems from some of the hormones that start from the brain and then go to the ovaries to be able to affect ovulation. And so, there are many conditions like diabetes, for example, where there's a lot of hormonal dysregulation that starts from the brain. And so, I think this is really opening up the box for people who are not only just OBGYNs, but other physicians to get involved. An endocrinologist should be involved. Maybe your primary care physician should be involved. And you need a team of medical providers, not just your OBGYN, trying to focus on, okay, how can I make you ovulate? Are you trying to get pregnant? How can I make you ovulate, right? So you can do that. Or how can I make your periods regular? But also the insulin resistance that people have, the increased hair growth that people have. There's so many different symptoms involved in PCOS, and only having an OBGYN to target it and talk about it is not enough.
Right, yes. And I myself, I'm sure a lot of women in the PCOS community can attest to the facial hair. It's so frustrating, right? As a woman, especially already feeling like I'm not ovulating, my periods are irregular, I'm in pain, and now I have facial hair, and I can't control my weight. A lot of people's weight fluctuates a lot with PCOS. What are your thoughts on the conversations around GLP-1s targeting PCOS patients?
Yes. So I have a lot of patients who have PCOS, and especially who have insulin resistance, that are now qualifying for GLP-1 coverage with their insurance. And I'm hopeful that this name change will kind of, like I said, open the box a little bit more for this to be more widely used and accepted. Because patients have seen a lot of improvement with weight loss, with, just their metabolic function in general, decreasing their, sorry. Increasing their or improving their metabolic profile in general, lowering their blood pressure. There's so many different benefits to this medication, and patients with PCOS have a lot of room for improvement in the treatment options that we have to offer them.
Yeah, I think that's so fascinating. And I hope that there's more attention, like you said, at the level of even a general practitioner, because it feels as though a lot of times with women's reproductive conditions, the first line method of treatment is birth control.
Yes.
And it seems like there's more medications out there if you open up the umbrella to the entire body that could be beneficial to treat some of these conditions. So
Absolutely.
I'm curious from your perspective, why is birth control, and not you, because I'm sure you don't do that, because you're amazing, but why do a lot of OBGYNs, why is that their first line of treatment? I was put on birth control in like 8th grade or something, absolutely crazy, so young, because I was having such a horrible cycle.
Yeah. Absolutely. So in speaking to, what you've opened up about with your journey with endometriosis, we know that those endometriosis implants are driven hormonally by estrogen,
Yeah.
right? And so if you think about the menstrual cycle, I won't get too much into the weeds, but if you think about the menstrual cycle, it's kind of in two halves. So the follicular phase before you ovulate, and then the luteal phase after you ovulate. So in that follicular phase, that's when estrogen is the dominant hormone, and it peaks, pretty high, and then you ovulate. And after ovulation, progesterone is the dominant hormone. And so our way to kind of combat the natural hormonal spikes and fluctuations that lead to so many debilitating symptoms is with birth control, because it's giving your body a low dose of one or both of those hormones every day to try to suppress the drive that your brain is naturally trying to do. And so I know we throw birth control at a lot of things, but it's with good intention. But as you mentioned, it doesn't work for everybody, right? And so we need to make sure that there are other options and that we're keeping the umbrella open so that patients can share their experience too. Because I'm sure, starting birth control so early, did you have any side effects or anything that you didn't like about the experience?
Oh, for sure. I often wonder too. I mean, I've been on it since the 8th grade. I'm turning 33 in a month. Like, what are the long-term impacts on the body taking hormones that long? What are the long-term impacts of me not having a period since 2018? I mean, it'll be almost a decade of not having any sort of menstruation. I understand, like you said, why the suppression of the hormones and trying to lower my estrogen levels in my body, but it does make me wonder sometimes. And again, I feel like women's health is so understudied that this should be an easy answer. There should be research and answers, and I just feel like it's not discussed enough.
I've been on birth control since maybe college. So over a decade now. And I also got put on it because I had horrible periods. I used to have light periods, woke up one day and started having absolutely horrible periods, horrible symptoms, all of the above. And honestly, Christy, I want to ask you, when does it get to a point where you should consult your doctor because your periods are getting this bad? And I know sometimes they do really, like, we villainize birth control, but there's also a lot in you silently suffering with your period and how horrible it can be. So I understand why the doctor put me on birth control, because I'm like, I'm losing my mind. I'm not able to go to, I don't want to go to school. I don't want to go to class, all of these things. But, when does it get to a point where you really should reach out to your doctor and be like, hey, I'm noticing these symptoms with my period. And what should your next steps be? You know what I mean?
Absolutely. I think it's exactly what you just described, right? Like, you were going through your life and having these symptoms, and then after a while, you were like, wait a minute, I don't have to suffer, right? And so I think suffering is defined differently by every person, right? And so if that's, I can't go hang out with my friends on the weekend because I know my period is coming and I know I'm going to be stuck in bed and that really affects me, maybe that's the line for somebody, right? Some people have a higher tolerance where they're saying, okay, I understand my periods are super heavy. I'm managing it with other things. I'm taking my iron pills, to make sure my iron isn't getting too low. I'm changing my diet. I'm managing with exercise. But if at any point those more like conservative or natural practices are not helping, and especially if the symptoms are getting worse, I think it's time to have a conversation.
Yeah. And I mean, now that we mention iron, like, I've had low iron since middle school, and it's something that I've never really gotten to catch up on in life. And I feel like a lot of women have underlining like chronic illnesses that they're just not noticing and not knowing. It could be fibroids. It could be low iron. It could be a multitude of things. And we're not able to maybe advocate for ourselves, or we're nervous about how it's going to be perceived, or, I feel like a lot of times people take women's pain and the symptoms that they're having and maybe don't think that it's as serious as it is. And so, I mean, I'd love for us to kind of touch on fibroids, touch on, low iron and other things that also could be affecting your period or could be affecting even your endometriosis as well.
Yeah, absolutely. I think that it's so important to have multiple doctors on your team, right? I can think of a patient specifically right now who her primary care doctor had been seeing her for years for chronic fatigue. She had low vitamin D, she had low iron, and they're treating it. And finally, the doctor decides to ask her, what are your periods like? And the patient is like, oh my gosh, they last 8 days. They're super heavy. I'm passing clots, all of these things. And he said, oh, let me refer you to a gynecologist. And so the patient comes to me, I order an ultrasound, we do an exam and find multiple fibroids.
Yeah.
And it's like she's been suffering with this for so long before somebody decided to ask her about this one very critical piece of her health and well-being, her period, right? And the way women have suffered in silence, have experienced these things for so long, are not believed, are not trusted.
Yeah.
You know, I think it's really challenging to make sure that you're seeing providers that will understand, that will give you the benefit of the doubt, that will order the extra tests, even if they feel like it's not needed, right? If you are advocating for yourself
Yeah.
and requesting that something be done, I think that should be respected, right?
Yeah.
And so like fibroids we could talk forever about fibroids. It's
Yeah.
so common, especially in Black and Asian women, similar to endometriosis and PCOS. We don't know why it happens. There's so much research that is needed to get to the root cause of these conditions so that we can just stop, treating the symptoms
Yeah.
or taking out the fibroids and knowing they'll grow back, or taking out the endometriosis and then there's a risk that it's going to grow back, right? So lots of research is still needed, but so many conditions that women are suffering from that need to be developed
Yeah.
and researched more.
Okay, so looking at, like you said, there's so many different women's reproductive conditions that are understudied, underdiscussed. So looking at fibroids, ovarian cysts, that's one section, right? Obviously. How is that different than diseases more like endometriosis or PCOS?
Absolutely. I like to think of the uterus kind of in its layers, again, getting a little bit anatomic, but the inner layer of the uterus, the endometrium, that's what we think when we are thinking about endometriosis, right? There's then the muscle layer of the uterus, which is where conditions like fibroids or even adenomyosis can affect.
Yep.
So fibroids grow from the muscle of the uterus, but they can be in all layers of the uterus. They can be on the inner portion, they can be in the muscle, they can be on the outside. And then adenomyosis is when the muscle layer of the uterus becomes cystic, and can have some of those characteristic symptoms as well, like the heavy, painful bleeding, all the things, right? And so it's important to, be able to distinguish these because sometimes they have very different treatment options, right? Especially with fibroids, depending on how large they are, how numerous they are. Some patients need surgery right away to get rid of them and to improve their life. Sometimes the fibroids are pushing on the bladder, pushing on the like in all these different places and causing really debilitating symptoms. And like I said, it's extremely common.
Yeah, which that made me think of, I was in the ER, I guess it would have been a year and a half ago with an ovarian cyst, but it turned into a torsion.
Oh my gosh.
It was creating a torsion.
Yeah.
So I think to your point, a lot of people, sometimes it's just an ovarian cyst, it'll pass.
Yes.
It's so painful, but I'll be okay. I've had cysts before.
Yeah.
Can you explain why it's so important to get treatment when you're having debilitating pain, whether it is from a fibroid or ovarian cyst that could lead to a torsion and what that would impact you?
Absolutely. So just defining that also. So torsion is when the ovary actually twists on its blood supply, it gets swollen and causes very severe pain. And usually it's because of a cyst that this happens, though it can happen for, other reasons. But when there's a cyst growing on the ovary, there are lots of different types of ovarian cysts. Some of them are functional, so they're a result of ovulation. So when that egg pops out and is released into the abdomen, a little fluid pocket is left behind, and that's technically a cyst. Some cysts are larger. Some cysts are endometriomas, where that endometriosis tissue is bleeding into the cyst of the ovary. And so depending on what type of cyst it is, depending on how large it is, if it's causing your ovary to twist, if it's pushing on other things, treatment options may definitely be needed. For some patients who maybe just have like a small little functional cyst, sometimes we'll just kind of monitor it over time. But I always tell them, if your pain gets worse, if anything changes, please come back. Because one, none of this is a one size fits all, right? Like one patient may have a 3-centimeter cyst, which we think is, relatively small, but it may be causing severe pain and severe symptoms. So people just need to make sure they have a really good relationship with their doctor and can have these open, candid conversations to figure out what they actually need for their care.
So I know you mentioned that sometimes patients don't have a gynecologist that they see, and maybe they just see their primary care physician. Maybe that doctor is just prescribing them birth control, contraceptive, whatever it might be. When should you trust your gut and your intuition to be like, no, I need to really take this step all right, I really need to take this step forward in my health, go see a gynecologist. See, I've always seen a gynecologist. So that was like my first step. And I think a lot of times women see their primary doctor and don't know maybe that they also should be seeing a gynecologist and at what point.
Yeah, that's a really good question. I feel like people either do one of two things. They have a primary care doctor and never see a gynecologist, or they have a gynecologist and want the gynecologist to do their primary care too, which I love and is awesome. But maybe I'm a little biased. I think everybody should have both. Okay. Yeah. So your primary care doctor, some of them are very comfortable with managing women's health conditions up until a point, right? And I think if you're mainly seeing a primary care doctor, you need to ask them, hey, what is your level of comfort? And at what point would you refer me out also to a gynecologist? But in general, in gynecology, we recommend that women or girls see a gynecologist at least every 1 to 2 years. Just again, to do these regular checkups, talk about your periods, talk about any symptoms that have changed for you. That way we can kind of pick up on little subtleties that maybe a primary care provider wouldn't pick up on or wouldn't know that, hey, something's changed here. Something's a little bit abnormal now. So maybe we need to pursue some kind of workup.
Yeah, that makes sense.
I had a thought there just with the 1 to 2 years. So I think at a certain age, obviously pap smears are so important and ovarian cancer and, diseases stemming from HPV. It's such a prevalent STD in this day and age, or it seems to be more prevalent as every year goes on statistically. What are your recommendations on getting tested and getting a pap smear at a certain age? Is that yearly?
That's such a great question, because the guidelines for getting pap smears have changed fairly recently. So we start pap smears now at age 21. If you talk to like your mom or your grandma, they probably got pap smears starting at age 16 or whenever they became sexually active. But we know that HPV, as you mentioned, is so prevalent. And when we were doing routine cervical cancer screening or pap smears more frequently at younger ages, we were finding things that didn't really matter. And patients were having more uncomfortable procedures that they might not have needed. So now cervical cancer screening starts at age 21. We check the pap test in 2 ways. So we check the cells themselves. So if the cells themselves only are normal, then it's every 3 years. If the cells are normal and the HPV is negative, so they don't have HPV, then it's every 5 years, because we know that HPV is one of the leading drivers of cervical cancer. And so if the cells are already normal, HPV is not around, then it's every 5 years. I know people hear that and they're like, what? Yes. Still see your gynecologist every 1 to 2 years, but you may or may not need an actual pap test for cervical cancer screening depending on your history.
That's really good to hear. And it's interesting how the guidelines have changed. What would you say to a woman who's age 21 is the age that's scared to come and get a pap smear?
Yes.
What would you say to her?
Yeah. Oh my gosh. This is actually my favorite age group. I'm so excited. I love being a woman's first gynecologist, because I think you have to, one, find somebody that you trust and somebody that you can build a relationship with, somebody who's going to listen to you. And so I've had patients come in and they say, hey, I'm really nervous about this pap smear for many reasons. And my first question is, what have you heard about it? And most people say, oh, it hurts. It's going to hurt so bad. That's all that they're saying on TikTok. That's all that they're saying wherever, right? And so we talk about that. And I think it's important for patients to find a doctor who's just going to take a couple extra minutes to talk about what you're worried about, to talk about what you've heard about it, and to give you the agency to be like, no, I'm good, right? Like for some patients, I say, today we can do a pap smear. You just turned 21, but also today we can talk about it. And you can decide when you're ready to come back, understanding that this is a very important part of your health screening, right? And at any point during this experience, if you are uncomfortable, if something is painful, please let me know. I can make adjustments. We can stop. We can regroup. You can come back tomorrow, whatever you want to do to make sure that you're feeling comfortable with the experience moving forward. It's really important to, stay on top of these things, but it needs to be done in a way that's comfortable for the patient to move forward.
Yeah. I love that.
I feel like a lot of times, like, women are scared to almost say no to their doctor in that way of being like, oh, I want to, discuss my options more, or they're scared to ask questions. I feel like a lot of times, even when I go to the doctor, I'm sometimes scared to either bring up a symptom, to bring up a question. It's like, this is my health. I need to be able to advocate for it. I need to be able to, be comfortable and be in a good space where I can thrive and also like reach my
Absolutely.
goals, and also like really like I feel like we've all like suffered in silence, but also not have to suffer in silence and suffer in pain, which is very
Yeah,
insane.
absolutely. And I always encourage people, anytime you're going to the doctor, bring a list of whatever your questions are, right? And, you know, our appointments are limited, sadly, but maybe you tell your doctor, like, hey, I have these 5 things that have been bothering me for the last year that I want to talk about. How many of them can we get through right now?
Yeah.
And like maybe I make a follow-up appointment to go through the other ones that we don't get through. But just again, having that partnership and that relationship so that you have the space and opportunity to discuss the things that you're worried about.
I love
Really
that.
important.
I went through a really long journey between I would say my freshman year of college through 2018 when I was living in New York and working at the Gap and got diagnosed with endometriosis. And I actually had a binder that I brought with my notes and my labs and all of my testing results because you do have such a short window with these doctors. And sometimes you just feel like the whole appointment is like regurgitating things you've said to millions of other doctors, just trying to get an answer. Like I just remember being so desperate. Like I need to know what's going on. Like this isn't normal. Like, and like you said, if you don't advocate for yourself in the health community, obviously some doctors are incredible and amazing. And I'm so grateful for doctors like you, but sometimes you're just brushed off and pushed out the door. And you're just like, oh my God, I waited for this appointment, sometimes for 3-4 months if it's a specialist, and you're paying a premium, right? A lot of these doctors, like the insurance to even get in to get an appointment sometimes they're not even covered. So you're sitting in there and that appointment just feels so important. I'll just never forget those feelings and those moments. So I think, advocating for yourself and having a list and honestly utilizing AI and ChatGPT to summarize, I wish I had that back then, but like, here's everything that I feel, here's all my labs, dump it all in there and get 5 bullets to say to your doctor.
Absolutely.
Right?
Yeah, I think that's really important. I think a lot of doctors are hesitant when patients are like, oh, I did my own research, or I put this in
I'm curious your thoughts. Yeah, does that
ChatGPT or Claude or whatever.
Yeah.
I don't know. Maybe it's because I'm younger, but I'm like, tell me what ChatGPT said so I can go through it with you, and maybe Chat was right or maybe not. Maybe there's a little nuance that the AI didn't catch that we're catching now, and like we can make this make a little bit more sense. And so that's one of my favorite questions to ask is like, what did TikTok tell you?
Yeah.
What are you worried about?
Nowadays.
What did the internet
TikTok
tell you?
says so much. I'm like, TikTok has told me so many things. I have self-diagnosed so many things. But I think it's a good and bad in that sense.
It's
like
access. It's
obviously,
advocacy.
It is.
That's what's
and
at
I
people's
wish it
fingertips.
existed when I was diagnosed. I really do. Because
I
now
think
it's
it's
just
even
a pool of
important, like
information.
just hearing when you're kind of having certain symptoms and then you kind of watch someone's video and they're kind of like, for instance, when Lexy talks about what she's going through, I feel like a lot of women and girls even that didn't know that they were having these symptoms and like, oh, maybe this is something I should, like, obviously they shouldn't self-diagnose immediately, but that's something you should bring up to your doctor. Like, oh, I'm actually having kind of similar symptoms to like what she mentioned she was having, or it's really hard for me to want to go to class, hang out with my friends. Like I have no energy in the morning. There's a whole list of things where a woman might see that on TikTok and be like, oh, I didn't even know that was really an issue. And that's maybe something I should actually bring to my doctor or search for a doctor that's actually going to listen to what I have to say.
Yes.
Which is a whole conversation for another day of finding the right team, finding the right doctor so that it really does feel like a partnership. But it is a truthful fact. Like obviously social media has good and bad, but I think a lot of the times it's good in women's health because you're seeing what other people are going through.
Exactly.
And you're like, oh, that is actually an issue. Or maybe you see your friend, like, for instance, even while we're talking about PCOS and PMOS, like, I have so many friends that have been recently diagnosed with it. I'm like, oh, I thought that was just like a random thing that people randomly on TikTok where they're like waxing themselves on TikTok. I didn't really think of it as like something that my friends could be struggling with. You know what I mean? And like how I can support them in other ways like that as well. So it is good and bad of social media. As we're like going down the rabbit hole of TikTok, I'm thinking of just honestly how, like, I know we kind of mentioned this, but I have horrible periods. So I also skip my period every 3 months, gynecologist ordered. And with that, a lot of times my gynecologist has suggested that maybe I look into an IUD, and I'm like, oh no, TikTok says that an IUD is the most painful, horrible thing that I could ever do and I shouldn't get one. And that this is, and also I feel like TikTok also kind of talks bad about birth control, but that's a whole other story for another day. But I would love for us to talk about IUDs. So yeah, I would love for us to kind of just like get into the IUD realm. I'm obviously thinking about it as someone that's been on birth control for 10 plus years, and just the benefits that it can offer me as I have horrible periods, very long days, all of these things. So yeah, I'd love for us to talk about it.
Absolutely. This is one of my favorite. I keep saying everything's my favorite, but it truly is.
You're in the right profession.
So as someone who also has personally been on birth control or contraception since I was like 14 for heavy, painful periods, my IUD is my best friend. I'm on my third one. And it's true what people say, that they can be extremely painful and uncomfortable, which is why I think it's important to find the right person to do it, right? Kind of like with dating. Like you go meet somebody and you're like, hey, tell me about you. Like, what kind of things do you offer for your IUD placements? I'm thinking about one, right?
Yeah.
Because we have accepted suffering and pain in gynecology and with gynecologic procedures for way too long. For my patients, I offer lidocaine numbing jelly in the vagina before we even place the speculum. You can also get numbing spray on the cervix, a numbing injection on the cervix. And if patients have a ride home and somebody to drive them and they don't have to be responsible behind the wheel, I will also give you oral anti-anxiety medicine to take before your appointment. And so there's so many ways to keep people comfortable in the office. And I feel like with a lot of gynecologists, they haven't been offering these things for a while because
I didn't even know this was an option. I'm like, I need to come see you.
please. But because, it takes so much time. So, like, I don't know. Tell your office to extend your appointments. I get 30 minutes for procedures. I don't know. But I think it's important to make sure that people are comfortable, right?
Yeah.
If we even think about, like, the origin of gynecology, it was from this guy, J. Marion Sims, who, like, experimented on Black women who were enslaved with no anesthesia and was performing all of these treatments and tests and things on them. And I feel like so much of that has been carried forward where, it's just a little pinch. No, it's not. Like we are putting something sharp on your cervix. That's not a pinch. Like that can cause a lot of pain. And my first 2 IUD insertions were done without any anesthesia. The first, because I didn't know any better. The second, because I asked and the doctor told me no. And my third one, I went to my best friend, who's also a gynecologist, and I said, girl, give me everything we got. Okay.
Yeah.
And was it zero pain? No, but it was much more bearable than the ones that I've had before. And so again, shop around, find people who are going to give you the things that you need to keep you comfortable. But truly, my IUD has been one of the best things. I have not had a painful period. And even for some of my patients who we do them for heavy bleeding or for painful periods, they tend to be fairly satisfied, right? Everything's not going to work for everybody, right? I think IUDs are nice because they have some of the lowest possible side effects of all the forms of birth control. So I think if people have had negative experiences with other types of birth control in the past, an IUD might be a good option. But again, you have to make sure that it's going to be done by somebody who's going to keep you comfortable and prioritize that.
Yeah.
I think that's so great that you are even saying that, because when I go back to my IUD experience, I didn't even know that was an option. So to hear you say that you're offering this, all these different ways to make it more comfortable for the patient, I think that's incredible. I've had 2 separate IUD experiences. One, when I went under my first endometriosis excision surgery, they recommended we place it in during the actual laparoscopic excision surgery because it, really reduces that estrogen level. And I actually never got a period once while I had my first IUD in. Then I had that removed and I had another one placed in office. I'm pretty sure I had Teams up on my phone because I'm such a workaholic. So I was Microsoft Teamsing while they were inserting it in. I mean, it was a traumatic experience for me. Yeah. And I think because the first one was done under anesthesia, I just kind of thought, okay, this is nothing. Like it's fine. Like that, they kind of made it sound like, we're just throwing it in during surgery. I was like, okay, it's quick procedure. Like they're like, you can go back to work. And so I took myself, like I said, I was working during it and it was extremely painful. I had nothing offered to me. And then I think probably the most traumatic experience for me was taking that one out.
Yeah.
Really, really painful. And then I just remember the doctor taking it. It had been in me for like 3 or 4 years, 3 years maybe, and just putting it in the trash can next to me and being like, okay, we'll see you next time. And it's kind of just, it was really like a weird mental scramble for me, because I was like, we're just going to put that in the trash can. Like, I feel like there should be some aftercare and so the IUD for me was not personally the best route. My body actually rejected it. I don't know, what are they, the Marina? I'm not sure what it's exactly made of. It's a little plastic, right?
Yep.
So my body rejected it, which can happen with a lot of, things like that you put into the body, implants, whatever it is. But my body just completely rejected it. And I just was feeling absolutely terrible, really bad pain with intercourse that was way worse than just my typical endo pain. And so we took it out, and now I'm back on hormonal birth control. But I will say, not to let that story scare someone, because every single person is different. Exactly. I have friends who have stage 3, 4 endo, and they are so, so happy with their IUD. They swear by it. So I think everything's worth trying if your doctor thinks it's a good solution for your pain. But to advocate, like, if it doesn't feel right, say something. It took me far too long. Years. I was like, this is really not comfortable. Something is off. And again, even though I went through the whole diagnosis process, I still didn't feel. I was like, well, this is what the doctor said is the best option for me. So, but that's not the case. There's other options.
Absolutely. And I think you're bringing up such a great point. As physicians, we're the experts in our medical sphere, right? But patients are the experts in their bodies, right? And so if something is tried, that the doctor's like, oh yeah, this should totally work 100%. First of all, nobody should ever say that. But if they're like, oh yeah, this should totally work, and you're noticing that it's not, or that it's causing other symptoms, or you're having side effects, like, that's the importance of that relationship, so that you can be like, hey, I hear you, and this is not working for me.
Yeah, for sure. And I will add, I know not everyone is the most vocal, confident, extroverted human in the world. Like, it has taken me a long time to get that way in a medical office. I always say, bring an advocate. And even if there's people that you can literally hire as a medical advocate if you do not have a family or friend that can come. But sometimes in those appointments, when everything is so extreme and so emotional, and you're hearing things like, you might not be able to have kids, or, you might have to get an ovary removed. These are all things that have been said to me in appointments. It's a lot to take in. So having someone else there to ask questions and advocate for you, whether that's someone that you bring onto your medical team, or a friend, a trusted partner, a parent, I think it's really important.
Absolutely.
Do you see that?
I do. And I feel like for a lot of patients with chronic medical conditions, you're being flooded with so much information all the time. And so then it's sometimes even hard to remember, like, okay, wait, the doctor gave me this new medicine. What did they say the side effects were? What did they? And so I would even encourage, if doctors have like pamphlets or handouts or any educational materials that they can give you after your appointment, ask for those. Ask them to print something out for you so you can go back and reference it. Ask them to make sure they're like putting all the little nuts and bolts and details in their note, especially if you have access to that. So you can go back and read like, oh, this is why they thought this might have been a good option, or these are the side effects I need to watch out for or call for, those types of things.
Yeah.
So as we're talking about birth control, IUD, hormone therapy, all of that, I've heard that using certain contraceptives could maybe be masking what's really going on in my body and just kind of treating symptoms. When is that really a cause for concern? And is there truth behind that?
Yeah. I think that's a really important concern. And I think this is where language and perspective are really important, right? Because for a lot of these chronic medical conditions, whether it's PCOS, endometriosis, fibroids, diabetes, high blood pressure, whatever it is, there is no one simple root cause. And anyone who's telling you there is, I would question that a little bit. And so it's hard to make these conditions go away. And I feel like that's what a lot of patients are looking for, especially when they've been suffering for so long. They just want to be free. Like, they just want it to go away, but it's not always that simple. And so sometimes the treatment is overcoming what your body is trying to do, right? Overcoming your body's natural drive to have your estrogen really high and flare your endometriosis, or have your estrogen really high and flare your fibroids, right? And so a lot of that treatment is exactly what we've been talking about. Contraceptives, different forms of hormone therapy, different methods to suppress that natural drive that the body is doing. And whether we consider that masking or treatment, I feel like, I'm going to leave that to the individual, but I wish there were ways for us to just make these things go away. Similar to someone who has, diabetes and has to take insulin every day, right? These are chronic problems that we have to manage while we are waiting on the research to help us figure out how to eliminate them.
Yeah, that makes sense.
I believe with endometriosis specifically, a lot of women are diagnosed at an age that's very formative, and you're becoming a woman, you're in your mid to late 20s, early 30s. It should be earlier. Hopefully with medical research, this becomes in your teens, right?
Absolutely.
But you maybe haven't dealt with a lot of medical issues in your life. And a lot of the things that you've dealt with could be cured with one catch-all. And I think when I first was diagnosed with endometriosis, I was so frustrated because I was like, well, what can I take? What can I do? Like, and I had the surgery, and immediately after the surgery, you know, you get another MRI and it shows thickening of your uterine ligaments, AKA it's growing back, right? And that can become so frustrating. But throughout the years of me having this disease, recognizing and accepting that it's incurable, it will never go away. I pray that in my lifetime there is a cure, but for now it's incurable. I've learned to manage it. And I have a toolkit of things that I do that's, you know, it's a wide range of different things that range from medical treatment, like you said, hormonal therapy. I'm having another excision surgery in the fall, as well as things that I can do on a weekly basis, like pelvic floor physical therapy, which is so helpful if you're dealing with any sort of issues in your reproductive organs, because a lot of the times if you have PCOS or endometriosis or any sort of, you know, aggressive
inflammatory
conditions down there, your pelvic floor becomes hypertonic.
Yes.
And it's like a rock, right? And so you can go to pelvic floor physical therapy, which can help relax a lot of those nerves and cause some relief. It's obviously not getting, actually removing the lesions, which is truly the only real, and it's not even a cure. It's just more of it helps clean up the area and minimize your symptoms probably to the largest scale. But pelvic floor physical therapy, I've done trigger point injections. Those have been really helpful as well. I did that at Pelvic Rehabilitation Medicine. They changed my life in a lot of ways, an amazing clinic. And then, you know, just daily things, right? Like figuring out what diet works best for someone with endo and PCOS, and exercise and stress management. And when I first was diagnosed, I was so frustrated because I was like, oh, not someone telling me I have to go dairy-free and sugar-free to cure this extreme pain that I'm in. And maybe that's not what it is for you. But for me, I found cutting out certain things that were triggers. You kind of find your trigger list, what that is, has been instrumentally helpful in my healing. But I'll say that all with a grain of salt, because there's some days that I go to pelvic floor physical therapy and I had trigger point injections a couple weeks prior and I ate really clean and I still flare. Our bodies are going to do what our bodies are going to do. But I do feel as though I have more control on the disease when I'm doing these specific things that I know help my body. And again, this really wasn't discussed with me when I was first diagnosed. I had to go out and figure it out myself. And I'm now so grateful for things like social media and, you know, Reddit and all these threads you can read of communities of people. Reddit's not the best for some things, but for
Reddit trauma.
For health issues, I will say it is helpful. I will say if you have a health issue, it can be helpful. And it's pointing me in some directions where then I've double clicked and figured out what worked for me the best. So it's a complex disease. Women's health issues are very complex and under discussed. And to bring it back to the beginning, I think having more of these conversations will only help people feel more confident to push for answers and normalize, right? Like even, I'm going on a rant now, but like when I first started dating after having an endo diagnosis, I was like, how do I bring this up? And it's like, this is a very normal thing that affects, 1 in 10 women. Like be confident. It's a part of who you are, and whoever you're going to end up with will accept that and be open about it.
And they'll know how to support you, which I think is really important. And then when you're able to advocate for yourself, you're able to really get done what you need to get done. So whether that's managing your symptoms, maybe that's having surgery, whatever it is a part of your treatment plan. I think it's important to have these conversations, because then we're really taking the time to be like, oh, I didn't think about that. Or how can I support my friend better? Or, oh, my periods are really bad. Like maybe I should take this to a doctor. Maybe I should actually get a gynecologist. Maybe I shouldn't just see a primary doctor. Maybe I should have both. I feel like it's important to kind of like talk about this and discuss about this and like hear stories, and whether it's not fully endometriosis, it could be PCOS, it could be anything, it could be fibroids. So I feel like that's an important way to all of us to connect and also talk to each other. I mean, as we're talking about pap smears, as we're talking about fibroids, as we're talking about hormone therapy, which is also known as birth control sometimes, and contraceptive, I've had my hormones checked. I had a pap smear, came back a little weird, and they had to check my fibroids. Like when we're thinking about hormones and checking our hormones, like what does that mean? I think it's a lot of times everyone on TikTok is like, you need to have your hormones checked. You need to be balancing your hormones. It's like, how would I know how to balance my hormones? Do you know what
It's
I
a
mean?
catchy
Yes,
phrase.
Yeah, like
It's so catchy, and I feel like it's a hot thing to do right now, but like, what are we looking for? And what are we
Yes.
talking about? So I think first you have to start with like, what are your symptoms, right? What are you noticing? Because patients often come in the office and like their chief complaint, I want to get my hormones checked. I'm like, okay, great. Let's talk about that. Which hormones are you worried about? Oh, I don't know. Just check them all. I'm like, okay. And let's talk about things that are in my realm. So let's talk about your period, right? There are so many hormones that are involved in regulating your menstrual cycle, you know, the different symptoms that people are having. Is there something abnormal about what you're experiencing that warrants us taking this deep dive into your hormones? Because what we know is that your hormone levels fluctuate all times of the day, every single day, whether you're ovulating or leading up to ovulating or about to have your period. Like, there is such a wide range. And also a question that I ask patients is, how will how will these results impact what we're discussing, what we're trying to treat, or what we're trying to diagnose? Because if a patient is telling me my periods are perfectly normal, they come every 28 days, they last 4 days, I have a little bit of cramping on the first day, but after that, things are fine. I maybe use like 4 or 5 pads, and then they're not really that saturated, and then it's over. And then I have my next period 28 days later, right? That is a very normal menstrual cycle. Do
Yeah.
we need to go chasing hormones or running tests that may not actually be helpful?
Yeah.
Now, if someone says, I have had 3 periods in the last year, whoa, red flag right there already. Like, right? Like, maybe we need to start figuring out which of these hormones may be imbalanced. But I think just as a catch-all, like, oh, I just want to check all of my hormones, is not always super helpful, because which ones are we checking and what are we looking for?
At the base level, what are the top 3 hormones that can predict or lead to a PCOS diagnosis or lack of ovulation, which I guess, catches PCOS?
Yeah, for sure. So there are a lot to I can't even give you
so
3,
many.
but I'll just I'll name what my little order panel is for when someone has a regular period. So I check FSH, which is follicle stimulating hormone. That is what is being produced or your ovaries should be responding to when they're trying to ovulate or form an egg.
Yep.
I also check LH, which is another one of those hormones, luteinizing hormone, that is also involved in the same process. So both of those hormones for sure help regulate ovulation. Another one is estrogen and also progesterone, which we've kind of talked about a lot. They fluctuate at different times of the menstrual cycle. But again, PCOS is something that is polyendocrine metabolic. So there are other things to look for, right? I check patients' A1C, which is a measure for diabetes, because sometimes patients are diabetic and they don't know it, and that can cause dysregulation in their menstrual period. I also check different androgen levels. So if a patient is saying, oh, I'm like suddenly growing all this hair on my face, are your androgens high for some reason? And that's leading to dysregulation in all those other hormones that we talked about. I also check people's thyroid function, their prolactin levels. Like, this is such a complex medical issue. And so there's like literally 10 different hormones that you can check to try to lead someone to this diagnosis.
Definitely. I think most recently for me, I have had my AMH checked quite frequently because I'm trying to hopefully conceive in the next couple of years and freeze my eggs. My AMH is quite low for someone of my age, which was hard to receive that diagnosis, but that's, a conversation for another day with egg freezing and fertility. But can you elaborate on, for me, the AMH test and my hormone test were all blood draws. Is there anything that's outside of a lab draw for a hormone test that you guys would take?
Yeah. So most of them are blood tests, but something that patients also have access to is ovulation predictor kits, which most of them you can like find on Amazon or at the drugstore, wherever. And a lot of them are actually urine tests where you can do at home, and it measures certain hormone levels in the urine to try to predict when you're ovulating. And so for patients who are either trying to get pregnant or are having irregular periods sometimes, and we're trying to bring their period on to, manipulate their cycle and try to get them pregnant, sometimes they do ovulation kits at home too. So it doesn't have to be something that you have to go into the doctor's office to have ordered or have your blood drawn, but it's kind of, at your fingertips through the Amazon.
Is there a certain amount of time as women, like we talked about the frequency of needing to go in and get a pap smear. Is there a certain frequency or cadence as you go through your formative years and into your 30s and 40s that you should get your hormones checked and look at those levels?
That's a great question. And the technical answer is no. But again, I think you are monitoring your body, you're listening to your symptoms. And if something is off, then absolutely bring that up with your doctor. Even as women get into their 40s and 50s, into perimenopause and menopause, again, the hormone levels and the levels at which they are for someone in perimenopause fluctuates greatly, right? And so one test of the hormones may not give a complete picture of what somebody's experiencing. And so even with perimenopause and menopause, those are more so clinical diagnoses. And what that means is we go based on patient symptoms because we know that there's such a wide variety of what those hormone levels can actually be. But again, everything's a conversation with your doctor, right? If you feel like something is new or changing, if you're trying to get pregnant or experiencing infertility or wondering, okay, I am thinking about, I'm getting into my mid to late 30s. I'm thinking about having children one day. Like, what are my options going to be? What are my egg reserves like, right? Like, those are all very important questions about your reproductive health that need answers, right? So I think there are very specific moments where checking hormones, especially if we're being specific, right, can be very helpful and important. But just like a routine, every 2 years I need my estrogen checked, maybe not.
There's
so
some
much.
gray area. There's some gray area there. That makes sense.
I've had low iron like since middle school. Like I started chewing ice in middle school, like frantically. I have no back teeth because I've literally been chewing ice for, almost 20 years at this point. Like, it is really that bad. And I would love for us to like dive into that because I think a lot of times like having low iron can make a lot of your illness, a lot of your diseases actually even worse. Or it can also kind of be an underlining cause for something that you may not know is going on. And like when we're talking about low iron, like how often should you get that checked? What's the best way to treat it? What all goes into it? And also kind of reverting it back to, how it affects your period and why my doctor kind of asked me to skip my periods, because like I was losing so much blood in that sense. My periods were so heavy that she was like, ooh, you really can't afford to have a period every month. You don't need a cycle every month. Do you know what I mean? And that kind of thing. And at the time I was like, oh, I need to have a cycle every month, but then you don't need to have a cycle every month. You know what I mean? It's kind of just like a thing back there. But yeah, like going into that, like how do you tackle low iron and how do you monitor it?
Absolutely. So I think, again, that's something that comes down to symptoms, right? So if someone is having chronic fatigue, you wake up every morning feeling tired, you don't have energy to get through your day, iron is one of the things that should definitely be checked, including a blood count or a CBC where we're looking at your hemoglobin levels as well. And so if someone comes back with low iron, a lot of times first line treatment is iron pills. Not everybody tolerates iron pills very well. They can cause
I cannot. I have IBS. Like I actually could not do. And I have the constipated IBS. So I was like, iron pills are not. No, they didn't work for me.
Poop.
I didn't. I don't.
So the iron pills can cause a lot of stomach upset for patients, whether it's constipation or diarrhea or cramps or whatever the case may be. And so if that's not working for people, I will easily refer someone to get IV iron infusions. It's usually done in like a series. Like some patients get like a high dose in one, or you may get three smaller doses or 5 smaller doses. But patients have a lot of improvement in their symptoms. I've been treating women who have had fibroids and suffering with heavy bleeding and low iron for years. And after 3 infusions, they're like, oh my God, I didn't know I could feel this good. And I'm like,
actually,
wow.
That's literally what happened to me. I think there was a point, it was last year, my iron was so low, I literally had to do the infusions. There was actually no other option. And I, at the time, like felt like, when you realize you have low iron, you start trying to incorporate more iron. And even when sometimes it's not enough. And so that was kind of when I had a conversation, I think it was with my primary care doctor, but I was like, oh, my iron is really low. And I had the 3 spaced out infusions, and it literally changed my life. Like it really did get me back. I mean, obviously I still have low iron to this day, but it is now it's in a better place than when it was so low that like I was so concerned for my health. I don't think a lot of women realize that there are other options besides just like putting that little like iron fish in your food and
eating more steak.
Eating more steak. Not everyone eats steak. I'm like, I can only eat so many steaks in a month. Like, I was like, okay, I eat a steak on my period. Like, it's not enough.
And your gut is limited in how much iron it can absorb and process at once, which is why people get side effects from it too. So if there's a way to bypass all of that and like waiting on the body to absorb and put it in the right place, and then it just get the infusion. They hook you up, you know? You
and ask,
there a couple
I
hours.
think what's great, I think like to the infusion conversation, a lot of women don't know that that's an option.
No,
like I didn't know that taking medicine or like having the area numb was even an option for IUDs. And like, I did not know. I've been obviously struggling with low iron since middle school. I didn't get an infusion until I was like 27, 28. Why did I go like 15, 20 years? Why did no one offer me the option? And so I feel like that goes back to the conversation of you advocating for yourself and you almost doing a little bit of research or hearing about other options and just bringing it to your doctor. Obviously, you don't know if it's right for yourself. Yeah, you don't know what you don't know. So it's like, if I would have known that was an option, I would have immediately asked, okay, can we look into this? Like, should I just get an iron infusion instead of me actually being so constipated I can't function? So it's like, and I feel like that goes into the whole conversation of just like women not knowing that there's treatments out there that could maybe alleviate some of our symptoms, some of our stress, some of our pain. And it goes into the bigger conversation of advocating for yourself and also having a team that advocates for you, having someone, I mean, obviously that's my mom. Like my mom comes in my doctor's appointments and she's like, no, you didn't talk about this. You need to talk about this. Did you tell them that you haven't pooped in a week? Like, you know what I mean? She's like, you are like literally so tired you can't get out of bed. And like, that's a whole conversation. And sometimes you don't feel comfortable enough to mention that, or you honestly don't even think it's an issue to the point where you're like, oh, I didn't think that it was that big of a deal. And it is a big of a deal because like your health matters and you being able to function every day. You shouldn't have to like live not able to go to work, to see your friends, to do things, or waking up where you literally can't function, waking up where you can't come and hang out with your friends while we're in Costa Rica together. We're filming a TV show and you're having to, you know, take a break and step away so that you can feel better when really you should be able to be enjoying your life. And this should be a moment of happiness and enjoyment. And, you know, it's sometimes very debilitating.
Absolutely. So. And that's why I think this is so important. And Lexy, your platform, your voice are so important for people to hear these things, right? Because I don't know about you guys, but like my mom and her siblings, all of her sisters, nobody ever talked to us about like, oh, is your period too heavy? Is it too painful? Like nobody talked about that. And so again, if nobody's telling you that what you're experiencing is not normal or could be a sign of something else more serious going on, how are you going to know?
Literally.
Yeah. How are you going to know?
Yeah. You won't know.
Yeah. Exactly. My mom never had reproductive issues. So it wasn't really a big conversation in our family. And I just have one brother. And so to your point, it was kind of just, I guess my mom has been my number one advocate in terms of my health. But when I was in middle school and high school, it was, I guess the periods are just bad. And I guess let's just get on birth control to your point. And so I think now having these more open and honest conversations and just seeing the impact of me opening up about my endo on the show, I mean, hundreds, thousands of people have messaged me saying that it led them to a diagnosis. Like I was in Italy and I was at a winery in a remote area and a woman came up to me and said, the reason I had surgery was because of you. And I just broke down in tears, like the impact of just a small conversation that I had with Joey on a show that's lighthearted and fun, but you know, there's opportunity for conversations about deeper topics, and just the impact of speaking up about these things is so instrumental and so important. And I will continue speaking up about it until I can't anymore because it's so important to me. And I think to your point, like talking about Costa Rica and how it is more challenging, it's hard to even hear that sometimes because it's like, well, that's really every day for me and there's no change. Or there's not going to be this drastic change. But the way that I look at it, and I would say it to anyone that has endometriosis or an incurable condition, is I kind of just am living life like in cursive, where everyone else is kind of living life in regular print. Like things are just a little different for me, and days look a little different. But then if you take a step back, so many people are dealing with so many different diseases, and you really never know, especially with a disease that's invisible to the human eye. I think invisible illness is such an important concept. And so many people are struggling with things that you can't see, whether that be MS or endometriosis, myriad of different conditions and diseases. But just being patient with individuals, and you never know what someone's going through, whether that be a disease or something obviously emotional that they're struggling with in their life, and just having grace for
Yeah,
people.
it's like you don't know what your friend's going through.
Yeah.
Unless your friend might not even know that they might not even know that they have this. They don't know. They're just like, oh, they're living with these symptoms. I feel like that was a moment of like understanding, like, and even kind of saying things like, no, like Lexi's going through this. Like it's not, she's not here.
Yeah.
She's not down here with us because she doesn't want to be, you know what I mean? She's not down here with us because she's having a really bad endo,
Exactly.
like because she's really having horrible symptoms. Obviously, if she could go through it, she would be down here. Like, you know, that's the whole point. We only have a finite, is finite the word? We only have a small amount of time here, like together. And so like, just even I think also just standing up for your friends as they're going through things. And I think giving a lot of people grace, because you don't know, and they might not even know what they're struggling with, what they're going through. And like you said, every day is just like a different challenge in that sense.
It is. And like, it makes me literally emotional. But when I was first diagnosed, I remember saying, I wish, this is so like mentally crazy, but I was like, I wish almost that you could see it. Like, I wish that you could see my endometriosis. Like, if someone has a broken leg, it's like, oh my God, let me get the door for you. Like, let me, you know, and I just remember being like, I also feel it's this weird feeling of like, well, I'm grateful in a sense that you can't see it and I can mask it, but I also sometimes wish it was more visible so I had more understanding, whether that's, you know, just from the general public or people that are intimate in my life. And so that's, with invisible illness, I feel like kind of a very hard mental hurdle to get over.
Yeah, and I think about how many women are like just silently suffering with that, and then you don't even know that they're going through that.
Exactly.
Or you know what I mean? It's a very like two-edged sword in that way. And so it's very crazy.
I think everything that we've said in summary really leads to the point that is so heavily needs to be underlined, that these topics need to be more discussed openly, take the stigma away from them. And if you're watching this and you have any feelings of, I might have a reproductive condition where something's a little bit off, or, you know, my periods don't feel normal, or I have hair on my face, something doesn't feel like my friend and what she's experiencing, raise your hand, advocate for yourself, surround yourself with an amazing team of doctors. And sometimes I will add that takes time. You have to find a team that works for you, and that can be a push and pull like anything in life with finding the right relationship. And I just hope that this can reach women that are sitting at home potentially questioning, struggling, trying to figure out what's going on. I was in your exact seat. I still am in your seat. Every single day I'm trying to figure this out. And I hope that bringing our voices to this conversation, and Dr. Chrissy speaking about your patients' experiences, and Bailey speaking about how this impacts you on a day-to-day basis, really gives you guys the confidence at home to know that there are better days ahead, and that a lot of people are experiencing this, but there's a lot of solutions for it, and we're all here for you.